The last type of screw into C2 that's relevant is C2 laminar screws. So this illustration shows where they go. They go right down the lamina, the full length. You can put them in on both sides so they cross. They're excellent for pull-out strength, and of course, they're quite far from all the structures, the vertebral artery, the vertebral body up front. I find this to be a very useful technique in some situations, but I don't use it as my workhorse because in my mind, there are two problems with it. One of them is that these screws tend to be quite superficial. You can sometimes feel these screws. They're a little bit harder to connect up to your construct. And the other reason is because you need to have a lamina intact, so you can't have done a laminectomy at that level, and it needs to be large enough to permit not just one, but two screws. And so I find that to be something I will use on occasion or maybe as a supplemental fixation on top of par screws, but not as the primary mode of fixation at C2.